So we'll begin with the external nose. Okay, and then different parts of the external nose, which is the visible external part of the respiratory system. It has a free tip. It is known as the tip. The attached part, by which it is attached to the forehead, is known as the root of the nose or the bridge of the nose. Okay. Then on either sides there are two ala, yeah, two ala. Okay, these are known as ala, and there are two openings which are known as anterior or external nares. Okay. So these openings are known as anterior or external nares, through which air enters into the nasal cavity. Inside there will be a nasal cavity. Okay, so there are different parts of your external nose. So nose, just don't say nose, you say external nose. External nose has a tip, a root or a bridge, root or a bridge, a septum, an ala, and an external nares. Okay. Now these external nares are surrounding the external nares or the anterior nares. They are hairs, hairs. Okay, which are also known as vibrissae. 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 So these are known as nasal hairs. The function is to trap large foreign particles, some bacteria or viruses, and which pass through this, or dust particles which pass through this. So they act as a filter for certain objects, especially large objects. Okay, and this medially, so there are two nasal cavities, and the nose in the outside is separated by this part known as the septum. Okay, septum, and this part of septum, nasal septum, is known as columella. 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 So these are the different parts of your external nose. Root, tip, two ala. These are known as ala of nose. Okay. Ala is obviously plural, and two ala of the nose. Then the external layers or the anterior layers, which are covered by nasal hairs, also known as vibrissae. This part of septum, separating the two nasal cavities, are known as nasal septum or columella. Now, the formation of the external nose. So it is mainly formed by cartilage and partly by bone. So the above part, this part, so the root or the base is bony in nature. The lower part, tip, is cartilaginous in nature. So bones, what are the bones forming it? So this bone is known as nasal bone. Okay, this is your nasal bone. So you can see there are two on either side, which forms the root or the bridge of the nose. So this is your nasal bone. Okay, this suture is known as internasal suture. Above is your frontal bone. So this is known as frontonasal suture. Okay. Internasal suture, frontonasal suture. This point is known as nasion. Okay. This point is known as nasion. So it is mainly formed, the root or the bridge of the nose is formed by the nasal bone. This is the one structure forming the external nose. On the side, this is formed by the maxilla. So this is going towards the frontal bone. So this is known as frontal process of maxilla. Frontal process of maxilla. So this bone, can you see this? So this is your cheekbone. This is a cheekbone known as maxilla. It is going upwards toward the frontal bone. So this bone forms part of the root of the nose, which is known as the frontal process of maxilla. Now, cartilages. The cartilages are three. Okay. This cartilage is the largest cartilage, which is known as lateral process of septal cartilage. So in the nasal septum, there is a cartilage, so it is a lateral process, and this is your lateral process of septal cartilage. Besides this, on the ala, there are the major ala cartilage, and the 2 to 3 or 3 to 4 minor, minor alar cartilages. Minor alar cartilage. So they are the structures forming the nose or the external nose. So two bony structures form the root, which are the nasal bone. This is known as frontal process of maxilla. Frontal process of maxilla forms the root of the nose. Then the ala is formed by lateral process of septal cartilage. lateral process of septal cartilage, then the major and the minor alar cartilages. Major and minor alar cartilages. So they are the bony and cartilage structures forming the external nose. Now inside. So once you go inside the through the anterior nares, you enter into the nasal cavity. So this is a sagittal or parasagittal view of the nasal cavity. So you are seeing from the side. Okay, you know what is sagittal section. So it is not wholly sagittal but slightly parasagittal. So you can see now this is your lateral wall of the nasal cavity. You can see this is your anterior nares, okay, which is covered by hairs known as columella. This is your posterior nares or internal nares. So behind this it will be a nasopharynx or the pharynx. The pharynx has three parts, which will be talked about in a separate class. Nasopharynx, which communicates with the nasal cavity, oropharynx, which communicates with the oral cavity, and behind the larynx, laryngopharynx. Okay? This will be talked about in a separate class. So for now, remember, between the anterior nares and the posterior nares, this whole cavity is your nasal cavity. This whole cavity is your nasal cavity. And this wall that we are saying is the lateral wall of the nasal cavity. It extends from anterior nares to the posterior nares or choana. Okay? It extends from anterior nares. Okay? It extends from anterior nares, okay, which is known as external nares, to the posterior nares or the internal nares, also known as choana. CSO-A and A. Okay? Posterior nares or internal nares or choana. Now it is divided into right and left. So there are two nasal cavities, which is right and the left, which is divided by a median structure, which is your nasal septum. So now in this view, we are not seeing nasal septum. So it's not mid-sagittal, but slightly outside the nasal septum, which is the parasagittal section. Okay? So we are not seeing nasal septum here. Okay? So this is your lateral wall, and in the medial one, the midline, there is a nasal septum, which divides the nasal cavity into right and left. Also, it has a roof. It has a roof. It has a floor. It has a floor, and this is your lateral wall, and the middle wall is your septum, separating it from the right and left. So in this figure, you can see this. Okay? So this is a coronal section. Okay? This is a coronal section. So coronal section means it's dividing into anterior and posterior halves. Yeah? And you can see this is your roof. Okay? This is your roof, where you can see the sinus known as the frontal sinus. This is the eye. Above the nasal cavity will be eyeball. Okay? Below oral cavity forming the floor. This midline structure, so we are dividing it into right and left half, is your nasal septum. This is your lateral one that we are seeing here. Okay, lateral, which is very important. That's why we are showing this. So this is the uh, boundaries or the boundaries of the nasal cavity. Anteriorly, anterior nares, anteriorly, anterior nares, posteriorly, posterior nares or internal nares or choana. Above, roof. Below, floor, lateral wall, and the medial wall, which is known as nasal septum. Now, the roof is narrow, okay, and it is formed by certain bony structures, which are from. So we are talking from behind, so we are going from posterior to anterior. Okay, so first one is this bone. This is known as body of sphenoid. Okay, this is the sphenoid bone. Okay, this is known as the sphenoid bone. Okay, this is known as the sphenoid bone. Okay. This is the sphenoid bone, and the cavity, you can see this is the paranasal sinus known as the sphenoid sinus. So above will be a brain, right? So above the nasal cavity will be a brain. There will be a CNS part. And here you can see above this sphenoid sinus, this you can see this fossa. This is known as hypophyseal fossa, which contains a very important gland known as the master gland of the body, also known as the pituitary gland. Okay, pituitary gland. This is very important. Why? Sometimes, if it is pituitary tumors, because of the location of the pituitary gland, what you can do is you can go through the nasal cavity, through the sphenoidal sinus, and into the pituitary gland. So this is an easy way of assessing the pituitary gland if you have to do any surgery. And this approach is known as transsphenoidal approach to pituitary gland. So you can go to the sphenoidal body sphenoidal sinus into the pituitary gland, and you can do remove some parts of the pituitary tumor. If there is a tumor, yes. Okay. So relations roof body of sphenoid. This bone is known as is a very important bone known as the cubiform plate of ethmoid bone. Cubiform CRIBRI form plate of ethmoid bone. Okay? Cubiform plate of ethmoid bone. Why it is important? Why it's called cubiform? It's like a sieve. You know? When you cook, there's a it is like a sieve. Okay, so there are lots of holes in there. Okay, why it needs holes? Because optic nerve, sorry, olfactory nerve. So olfactory nerve is the sense of, it carries the sense of smell. It is your first cranial nerve. So olfactory nerves are in the are carry sense of smell from the nasal cavity and pierce this cubiform plate of ethmoid bone to enter into the sinus. Okay, so this way this is very important. When you go into second year in the skull, we'll show this again. For now, remember this. This is known as cubiform plate of ethmoid bone. Anteriorly, then there is the sorry. Anteriorly, there is the frontal bone containing the frontal sinus, and in front is the nasal bone and the nasal cavity. So they are the structures forming the roof of the nasal cavity. Body of sphenoid with sphenoidal sinus. Above this, there is a pituitary gland in the hypophyseal fossa or the pituitary fossa. In front, cubiform plate of ethmoid bone, through which the olfactory nerves, multiple olfactory nerves pass through it. That's why it is like a sieve with lots of holes in them. Then this is the frontal bone containing the frontal sinus, and in front, this is your nasal bone. Okay. Now this is the roof structures forming the roof of the nasal cavity. Now floor above below this obviously is the oral cavity and oral cavity. So there are two structures you can see. This is your hard palate. Hard palate means bony palate. Palate is made up of bones. Okay, there are two bones: anteriorly maxillary bone, posteriorly palatine bone. Okay, this you don't have to know. Just the floor is formed by hard palate. Behind this is a soft palate. Okay, and we feel with the tongue. In the roof of the oral cavity, you can feel this hard palate. So this is a hard palate, and behind will be a soft palate. So if you do you will see a uvula there, and this is a uvula. Okay, in the center stignum, that's okay. That is a uvula. Okay, so this is a hard palate and the soft palate, and below will be a oral cavity. So they are the structures forming the roof and floor of the oral cavity. This is a palatine bone. Now, we'll be talking about the lateral wall of the nasal cavity. Okay, lateral wall. So lateral wall is the most important one that will be usually asked in the exam. Nasal septum and the lateral wall is the most important one that will be asked in the exam. It's a very important thing that will be asked when you're going to ENT as well, because there are lots of openings of your paranasal sinuses. So you can see lots of bones are there. I'll not be talking about the different bones forming the lateral wall of the nasal cavity. If you want, you can go and study. It's not so important exam wise, so as well as clinical wise, so I'll not be talking about that. Okay? If you want, you can see there are lots of bones forming the lateral wall. All the bones are given here. Now, what is important is there are three shelves or projections coming out from the lateral wall, which are known as concas, and these are very important. So, first one is this one. Okay, now this is part of the ethmoid bone. Okay, and this is your superior concha above one. This is a middle concha. These are all parts of the ethmoid bone. You can see this is the cubiform plate. You can see lots of holes in cubiform plate of ethmoid bone. So they are colored green. All bones have been colored different colors. Okay, this is your superior concha and middle concha. These are projections from the ethmoid bone. And below, third one is a separate bone, which is your inferior concha. So there are three projections on the lateral one known as the concha. The first one is superior concha. This one is a middle concha, and below third one is your inferior concha. Superior concha, middle concha, and inferior concha. Now this is covered. Now this one was bony. The first slide was a bony structures. Now this is covered by obviously by nasal mucosa and mucous movement. So you can see this is your now this is covered by mucosa. In this figure, you can see this is superior concha. This is a middle concha. and this is the inferior concha. Now, the space below this, so below this superior concha, there is a space. Can you see? This is known as superior meatus. Below the middle concha is known as middle meatus. Below the inferior concha is known as inferior meatus. Okay, so there are three meatuses. Below the superior concha is superior meatus. Below the middle concha, this space is known as middle meatus. Below the inferior concha, this space is known as inferior meatus. This again will show when you have decision, will be showing all these structures. You have to identify them. It will be asked in a theory as well as in a gloss examination. Okay. So the other three matrices. Matrices are spaces below the projections of bones, which are known as concha. Below the superior concha is known as superior meatus. Below the middle concha is known as middle meatus. Below the inferior concha is known as inferior meatus. Now, in these matrices, okay, there are certain openings which are very important. That will be asked in exams. That's why I'm talking about those. This is a very important slide. So exam point of view, this one is the most important one, and the second one is the second. Okay, that will be asked from exam point of view. This is the most important one. So now we'll begin with. Okay. So what has happened here? What we have done is we have caught the different concha. You can see superior concha has been caught, middle concha has been caught, and inferior concha has been caught. Okay? And so you can see in the middle meatus, this bulla, this elevation is known as ethmoidal bulla. Okay? And below this, there is a hiatus or the depression known as semilunar hiatus. Okay? So this elevation is known as in the middle meatus. This elevation is known as ethmoidal bulla. Below that, there is a semilunar groove known as the semilunar hiatus. And in front, this part is known as infundibulum. Okay. Now we'll be talking about the different openings in the different matrices. So we'll begin with inferior meatus. So inferior meatus, you can see at the anterior part of the inferior meatus, there's a small opening. Can you see this hole? Okay, this is the opening of the nasolacrimal duct. Nasolacrimal duct. So in the name itself, you can know what gland it opens. So it's the opening of the lacrimal gland. Okay, what is lacrimal gland? It is located in your eyeball, right? In the lateral, in the roof of your eyeball. So it's a lacrimal. So it helps in formation of tears, protects the eye and eyeball. So this formation of tears. So these tears will drain through a duct known as the nasal lacrimal duct into the inferior meatus. So because of this, and if you remember, if you cry too much, what will happen? You began to uh, have secretions from your nose. Right? Okay. Why this happens? Because of this. So because of the excessive lacrimal secretion, this will be drained through the nasal lacrimal duct into the inferior meatus. So this will then come out from as a nasal secretion. If there is overflow. Okay. So remember this, in the inferior meatus, there is only one opening, which is the opening of the nasolacrimal duct. So tears will drain. Okay, lacrimal gland will drain. Now we'll begin. Now we'll go into middle meatus. So there is only one opening in the inferior meatus. Now middle meatus, there are lots of openings, which are very important. So first we'll begin with the anterior part of the infundibulum of the semilunar hiatus. In the infundibulum, the frontonasal duct. So frontonasal means from the frontal sinus. This is your frontal sinus. So frontal sinus is a duct which opens into this infundibulum. So frontal sinus is a paranasal sinuses. So what are paranasal sinus? We have a separate class on this. For now, just remember the openings. Okay. So this frontonasal sinus opens into the infundibulum, as well as the anterior ethmoidal sinus. Ethmoidal sinus are three in nature. Yeah, are present in three groups: anterior, middle, and posterior. Anterior, middle, and posterior. So anterior ethmoidal sinus and the frontonasal duct opens into the anterior end of the infundibulum in the middle meatus. Now, the maxillary sinus, which is the largest, most important sinus, opens into the semilunar hiatus. This is the semilunar hiatus. In the middle part, it will open there. Then so this has been. Can you see this above? Okay, this is your ethmoidal bulla. So in the ethmoidal bulla, middle ethmoidal sinus is open. Okay, so in the middle meatus, there are three structures opening there. Four structures are opening there. One is the frontal sinus, Yeah, and the anterior ethmoidal sinus. In the ethmoidal bulla, middle in the ethmoidal bulla, middle ethmoidal sinus, ethmoidal bulla, middle ethmoidal sinus, okay, middle ethmoidal sinus. Then in the semilunar hiatus maxillary sinus. Spelling is wrong, sorry. Okay, MAXILLARY. There is no A. Maxillary sinus. So the other three structures opening into the middle meatus: frontal nasal sinus, frontal sinus, and the ethmoidal sinus in the infundibulum, in the ethmoidal bulla, middle ethmoidal sinus, and in the semilunar hiatus maxillary sinus. Now in the superior meatus, posterior ethmoidal sinus will open. Okay, posterior ethmoidal sinus will open into the superior meatus. Now above the superior concha, there is another space here. This space is known as this space is known as sphenoethmoidal recess. Sphenoethmoidal recess. Why? It lies between sphenoid bone and ethmoidal bone. So this space is known as sphenoethmoidal recess. And what opens here? Opening of the sphenoidal sinus. Opening of the sphenoidal sinus. So you have to remember 1, 2, 3, 4, 5, 6 structures opening into the lateral wall of the nasal cavity. This is very important. This will come in entrance exam, NMC entrance examination, will come in PG entrance examination, will come in ENT as well. Okay, not only anatomy. So this is a very important structure that will open into the lateral wall of the nasal cavity. Nasolacrimal duct opens into the inferior meatus, in the middle meatus, in the infundibulum, frontal sinus, and anterior ethmoidal sinus, in the ethmoidal bulla, middle ethmoidal sinus, in the semilunar hiatus, the maxillary sinus, in the superior meatus, posterior ethmoidal recess, posterior ethmoidal sinus, then the sphenoethmoidal recess, sphenoidal sinus. So the other structures opening into the lateral wall of the nasal cavity. And there are three concha: superior concha, middle concha, which are parts of the ethmoidal bone, and there is a separate bone known as the inferior concha. Now, another important topic that is usually asked is this. Okay? The one is the last one that I showed, openings in the lateral wall of the nasal cavity. This one is another important topic that usually asked again in ENT as well as in anatomy. Okay, this is one of the most commonest questions that is usually asked in the theory paper. Okay, either this is asked or lungs is asked in the anatomy. This is the most common one. Okay, lungs or this usually comes. So the middle wall, it is formed by the also known as the nasal septum. Okay. So it is made up of bones. It is made up of, so these are bones. Okay. It is made of cartilage, and anterior part is made of skin. So there are three structures forming the nasal septum: bones, cartilage, and the skin. The skin cuticular part or the skin part is known as columella. We always talked about this in externals as well. Okay. The bones. What are the bones forming the uh, nasal wall? So first bone is this large bone, perpendicular bone, known as the vomer. Okay. So I've done in your picture only. So in exam you have to draw as well as label. Okay, both you have to do. They will say write down a label diagram showing the formation of the nasal wall, nasal septum with its artery supply, applied importance. This is how it will come in the exam. Okay. So vomer is the bone, perpendicular bone. This is vomer bone, first bone. Then this is another bone. This again green is ethmoid bone. So this perpendicular plate of ethmoid bone. This is known as perpendicular plate of ethmoid bone. Second bone. They are the two main bones forming the nasal septum. Okay. Other are small bones. They are the two main bones: vomer bone and perpendicular plate of ethmoid bone. So that this you always write in first. In third one, others are smaller bones. Third one is this nasal bone. Nasal bone. Fourth one is this again from the frontal bone, which is known as the nasal spine of the frontal bone. Nasal spine of the frontal bone. Below, these are the nasal crest of maxillary and palatine bones. There are two bones I have labeled as one. Nasal crest of maxillary and palatine bones. So they are the 6 bones forming the nasal septum. First one, vomer. Vomer. Second one, perpendicular plate of ethmoid bone. Perpendicular plate of ethmoid bone. They are the two main bones, vomer and perpendicular plate of ethmoid bone. Then two above nasal bone, nasal spine of frontal bone, nasal bone, nasal spine of frontal bone. Below, nasal crest of in front is a maxillary, behind is palatal. Nasal crest of maxillary and palatal bones, which arises from the heart. So there are the five or six bones forming the nasal septum. Okay, this is so small sometimes. Yes, there's small bones from the incision. Again, is part of the maxillary bone, which is known as incisor crest. Okay, these are again from the maxillary bone, known as the incisor crest. So they are the bones forming the nasal septum. Now behind anteriorly it is formed by the cartilage known as the septal cartilage, septal cartilage, and septal cartilage. The cartilage is only one. You just write septal cartilage, and in front it is formed by skin known as the columella. So they are the structures forming the nasal septum. This we have to write. So you write bony part, then cartilaginous part, then skin part. Bony part, six bones: vomer bone, perpendicular plate of ethmoid bone, nasal bone, nasal spine of frontal bone, then nasal crest of maxillary and palatine bone, incisor crest again part of maxillary bone only. So there are six bones. Vomer, perpendicular plate of ethmoid, nasal bone, nasal spine of frontal bone is maxillary bone. So nasal crest of maxillary and palatine bone again incisor crest which is again part of the maxillary. Then septal cartilage, so the septal cartilage in front by skin known as columella. Now, linings. Now, we'll be talking about the linings of the nasal cavity. So, linings, obviously, the vestibule is the entrance. This part is known as the vestibule. So, through which air enters. This anterior nares is the opening. And the area, this part, anterior part, is known as the vestibule. It has hairs, how I already said, covered by short curved hairs known as pubicae, BI, SSAE, which functions to remove some large dust particles. It has to and it removes dust particles from entering the nasal cavity. Now, there are two types of nasal septum, two types of mucosa in the nasal cavity. Above a roof and the upper surface of the nasal septum, as well as the superior concha, superior spondylosis, or you can just say roof of the nasal cavity is covered by the olfactory mucosa. Olfactory mucosa. So this olfactory mucosa will be talked about in detail in case of when you go into special senses in the second year. For now, remember that the roof of the nasal cavity is covered by olfactory mucosa. The function is olfaction or carries sense of smell. Okay, and this form so there are special cells, sensory cells there, which from which olfactory nerves will pierce this roof, known as the found by the cubiform plate of the ethmoid bone. Then the olfactory nerve is found, which enters into the cells. The rest of the cavity is lined by respiratory mucosa. Okay, this again we'll talk more about in histology. Respiratory mucosa is usually pseudostratified ciliated columnar epithelium. Function of respiratory mucosa is the respiratory mucosa is made up of pseudostratified ciliated columnar epithelium with goblet cells, rests on a thick network of thin-walled veins. Function of these veins is to warm the air as it enters into the nasal cavity, so it goes into the lungs, so it warms the air. Then another function, it produces mucus. Function of mucus is moisten the air, add water content to it. Then second function, it helps to trap the incoming bacteria and foreign debris, dust particles. They have to trap that. Then the function of cilia is to have to move the contaminated mucus posteriorly towards the throat, which comes out as cough, or it is swallowed by the stomach. Okay. So the other functions of the respiratory mucosa. One, it warms the air. Second, because of mucus, traps foreign particles and moistens the air. So, they are the three main functions of the respiratory mucosa in the nasal cavity. One, warming of the air. Second, moistens because of the mucus. And third, removes foreign particles because of the mucosa. Okay, goblet cells are the functions which produces mucosa. Again, when you do in histology, we'll be seeing the goblet cells. Now, artery supply. So first, usually the nasal septum will be divided into three-part questions. First will be about nasal blood supply. Second will be about formation. Second will be about blood supply. Third will be applied impulse. The other three questions that are usually asked. So blood supply, again there are five. We'll go from 1 to 5. Okay. Artery supply, of nasal septum is very important. Okay. because of epistaxis. Epistaxis is nose bleeding. So first one is known as septal branch of anterior ethmoidal artery. So it is as a ethmoidal bone. So it is known as anterior ethmoidal artery. Again, all are septal branches supplying the nasal septum. Second is posterior ethmoidal artery. Second is posterior ethmoidal artery. Posterior ethmoidal artery. Third is sphenopalatine artery. Fourth is septal branch of greater palatine artery from the palate. The fifth one is the labial artery. Okay, labial artery. So there are five arteries supplying the nasal septum: anteethmoidal, posterethmoidal, anteethmoidal, posterethmoidal, sphenopalatine, sphenopalatine, greater palatine, sphenopalatine because it is from second bone. You can see easily. So bone, if you remember bone, it is anteethmoidal, posterethmoidal, sphenopalatine, greater palatine, and superior labial from the lips. Labial means lips, and superior labial. All are septal branches. Now, these all arteries will anastomose in this area. Okay, this area is known as, so all arteries are anastomosing here. So because of this, nasal septum is highly vascular, especially this area. Okay. This area is prone to nosebleeds, and this nosebleeds is known as epistaxis. Nose bleeding is known as epistaxis. Epistaxis. And this area where the anastomosis of all these arteries occurs is known as Kisselbach's area or Little's area. Kisselbach's area or Little area. So it is not. It is in the anterior inferior area of the nasal septum. Anterior inferior area of the nasal septum. So this area is prone to nose bleeding. Nose bleeding may cause due to various reasons. If there is high blood pressure, or if you do nose picking, or if there is blood to this area, so different reasons may cause nose bleeding. Lots of reasons of nose bleeding, epistaxis, and this area is known as Little's area or Kisselbach's area. This is very important. This will come in the exam. Okay, it will be asked what is Little's area, or they will ask what is Kisselbach's area, or it will come as a tail question to your nasal septum. And this is something clinically also very important. Okay? This will come in the exams, in exams as well. The nerve supply. Now, obviously, a sense of smell is carried by the olfactory nerves, which passes through the cribriform plate of the ethmoid bone. Then, a sensory supply is by the anti-ethmoidal nerve. Anti-ethmoidal nerve, there's only one. Yeah. Then this is known as, this is not sphenopalatine. Sorry, I made a mistake. Okay. This is nasopalatin nerve. Nerve is slightly different from artery. Artery is sphenopalatine. This is nerve should be nasopalatin. Nasopalatin nerve. Nasopalatin nerve. So, these are the three nerves supplying the nasal septum. Olfactory nerves obviously carries the from the roof of the nerve, from the roof of the nasal cavity carries olfactory stimulation, olfaction to the cribriform plate of the ethmoid bone. There are two nerves, anti-ethmoidal nerves and the nasopalatin nerves. Venous drainage, again same, not so important, same veins as same as the arteries, but then ultimately into facial veins, ophthalmic vein, and sphenopalatine. Lymphatic drain, uh, the vestibule area drains into the submandibular lymph nodes, remaining drains into the deep cervical lymph nodes. Functions, we have already said, it helps to warm. How? Because of the rich blood supply. Cleaning. How? Because of the mucus production. You have to trap the foreign particles. Humidifying. By again mucus production, you have to add water. These are the main functions of the nasal cavity. Resonance, again, it helps to provide resonance to the voice. That main function that is done by the, obviously by the paranasal sinuses. Again, nasal twang to the different voices are added by the nasal cavity. So it helps in also in voice production. Again, roof is contents of olfactory mucosa, helps to carry sense of smell. Obviously, facial appearance and nose, because of this, there are lots of cosmetic surgery done in the external nose to make yourself look beautiful. Obviously, so it has a cosmetic goal. It helps in the person's appearance as well. Now, applied importance, obviously, little's area is the common site of bleeding from the nose. Inflammation of the nasal mucosa is known as rhinitis, maybe due to viral cause and a flu, everything which causes nasal congestion, causes excessive postnasal drip. Infection of the nasal cavity may lead to infection of the paranasal sinuses, which are known as sinusitis, may spread from the nasal lacrimal duct into lacrimal gland into the eyes. Okay. So this is about the nasal septum. Obviously, sometimes the nasal septum, instead of lying in the midline, may be deviated towards the right or towards the left. So slight deviation will not cause any problems. But if there is too much deviation, it might lead to breathing problems. It might lead to cosmetic defects. So this is one of the most common surgeries done in the nose. Is one of the which is deviated nasal septum. Obviously, these sinuses, infection of the sinuses, I think will be talked about in the perineal sinus. So I think I'll skip this one. Deviated nasal septum, I said. Thank you. Do you have any questions, anyone? I'll give you the PowerPoint as well. सिया सादिला तपाईँ हुन्छ
Yes, sir.
म एटेन्डेन्सले पठाउनुहुन्छ कि मैले यही सेभ गर्ने हो
म पठाइदिन्छु सर
ए ओके 91 को 92 हुनु थियो हैन प्रेजेन्ट पैसा अझ कोही बाँकी छ 80 भइसक्यो ओके I'll give you the PowerPoint as well. So from today's
Okay,
class, please remember nasal septum and lateral wall of nasal cavity is very important. Thank you.